I'm Dr. Karen Mulvihill, and I'll be talking with you today about how we do an examination on a dog here at Sacramento Animal Hospital. And this is Cosmo. He'll be our assistant today and be our patient for the day. Normally when you come to see our doctors here at Sacramento Animal Hospital, our assistants or our nurses will have already taken the animal's temperature and gotten its weight and brought it in the exam room for us, asked you a few questions about why you're here, so that when I come in, we're all ready to get started with our examination. So often I'll start by just examining the general attitude of the dog, and as I talk with you, I might watch the dog, see how it responds to me, make sure that it acts in an appropriate manner, it's alert and it's bright and it's happy, and make sure that we have a healthy appearing dog. I'll often just be petting the dog when I first come in the exam room, and as I'm doing that, I'm often doing things like I'm examining the lymph nodes, and I'm feeling the general body condition to make sure he feels like he's about the right weight, not too skinny, not too fat, and looking at his coat, seeing if his coat appears healthy and shiny. As I'm petting him, I'm feeling for any lumps or bumps that are abnormal that we need to investigate further. So as we're just kind of getting acquainted here and talking to the dog, we're also examining at the same time we're doing that. And once we've done our initial general evaluation, we'll move on to the body systems. We generally do a tip of the nose to the tip of the tail exam here at Sacramento Animal Hospital, so we do examine the whole dog. And I'll usually start by looking in the ears, make sure they look clean, and there's no discharge, and there's no odor. Sometimes we might use specialized instruments like an otoscope to look in the ears. And most dogs are fairly cooperative. Sometimes it's uncomfortable. We need an assistant to help us with that. Then I'll move on to look at their eyes. I'll make sure they look healthy and bright and shiny, and there's no discharge, and there's no sign of cataracts. And again, sometimes we may use specialized instruments like an ophthalmoscope to look into the back of the eyes and make sure that everything looks fine back there. We'll look at their nose, make sure there's no discharge, make sure there's nothing going on there we need to worry about. We'll check their teeth, looking for tartar or looking for any kind of dental disease. Good boy. And then we'll continue working our way back. I'll often then feel their abdomen. And what I'm feeling for here is to see if there's any abnormal enlargement of their organs, make sure they're not painful, that everything feels smooth and relaxed. Everything feels real good on Cosmo here. Then we always listen to their heart and listen to their lungs to make sure everything sounds normal. Good boy. And as we're talking, we'll often have our hands just on the animal, running our hands over the animal and feeling for anything and just seeing a general feel for how everything is going here and if the animal looks healthy. We'll often check their feet, looking for do you have any long nails, any problems between the toes. And again, looking at the skin all the way around the dog to make sure that there's no skin problems. And that's a pretty thorough examination on our animals here at Sacramento Animal Hospital, and if we have any specific problems that we need to address, we delve into that at more depth.